about stroke, migraine headache, and we're going to ask ourselves the question, is stroke hereditary? And the answer is yes. In a lot of ways, strokes are hereditary, but usually for certain diseases that we know about right now. So without further discussion, we are going to talk about one of my favorite topics and a movie. Um, Hold on, let me just pull it up. My favorite movie, one of my favorite movies is this Firestarter movie, and it has this great scene. And here it is. Let me pull it up. You can't see the screen yet? Okay, it's going back. Going back here. Going back here. Oh, wait. One of the things that I love about this video is this right here. Perfect shot to the head, and then here's the migraine headache, and the migraine headache, and then the symmetrical bleeding from both sides of the nose. Okay, so migraine headache. So what's going on? We did an MRI on this guy, and we found that he had CADASIL. And what is CADASIL? So CADASIL is this thing that's cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. Leukoencephalopathy, CADASIL. So as a model of small vessel disease. So the idea here is that this thing is this autosomal disease. It's associated with this notch 3, and it's got this bilateral temporal white matter disease that you can see on the MRI. I don't have pictures of it, but that's basically it. So you do this guy comes in with headaches. He's from 30 to 40. This guy looks like he's about 34. He's got a daughter, and the daughter starts fires. And the key here is that not that the daughter starts fires, or nor that he can control people who have guns in their hands, but he has leukoencephalopathy that is building, and we have to treat this. And you know, probably don't want to treat it with aspirin or anything like that, because it's an arteriopathy that's in the brain. And also, you know, there's no literature really on it, but as far as treating these people with TPA, I'm really not excited about treating these people with TPA, and I've always wondered if they'll ever mention it in the stroke guidelines as far as TPA and that. And in fact, why not just look it up real time and find out and say, look, CADASIL and TPA, what's the deal? And TPA, let's see, successful use of, there's slight evidence against it. Okay, so my gut feeling was that, look, I'm not really excited about it. And the first article says that there's only a very little evidence against the use of IV in patients who present stroke-like symptoms, but nothing is concrete. It's also been suggested that some patients who are undergoing have been treated with IV TPA with favorable results, but unfortunately are not reported. Further studies and large clinical trials are necessary. So right now, I don't know. We have to look at, as far as CADASIL is concerned, would you treat these patients with TPA? And you have a 35-year-old female patient to the emergency department. Now, yeah, of course. So one thing I do want to talk about is usually it's a female patient who has these subcortical infarcts and leukoencephalopathy, but it's autosomal dominant, so that doesn't mean that a male cannot have this disease. So that's something that you probably want to think about as far as, is stroke hereditary or not. Now, there are multiple different areas of stroke that are there. This is just one disease that I wanted to talk about, which is this cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. So it's got a lot of stuff that's going on here. The key is that you've got headaches, and that is usually the thing that comes on. So a patient that comes in with headaches is oftentimes a very troublesome thing as far as stroke is concerned, because close to 80% of strokes actually present with headache. So you've got ischemic stroke. So it's not like you can just say, look, I'm not going to treat everybody who comes in the door without a headache. So oftentimes what we do is we do a CT angio, head neck, and we do a perfusion study on those patients just to see what else is going on in the brain. And then sometimes we just send them off for an MRI and with a protocol and see, is there a stroke budding there, and is there anything else that could be causing the headache that you don't know about. And of course, there's the all-pervading subarachnoid hemorrhage that you absolutely want to miss, and not give TPA in that situation. So I'll rephrase that: you do not want to give TPA in a patient with a subarachnoid hemorrhage. That's bad. And of course, anybody who comes in with a sudden onset severe headache, you always want to have that in the back of your mind and probably not give TPA, which makes it difficult in the time of COVID-19 because there are severe headaches that do take place. And sometimes it's difficult to be able to tease these apart as far as our patients are concerned. So that is my discussion on Are Strokes Hereditary, CADASIL, and there are 15 other parts of stroke that we talk about hereditary, and we will get into those in other videos. But this is the only hereditary one that I'm going to talk to today because it will be boring if I do all of the hereditary diseases in one clip for me, because I don't have enough movie knowledge to be able to tell you and pull up one movie. So I have to do some research. Okay.